Hello, everyone. My name is Mace, and I'm a volunteer with SHINE, which is an acronym for Servicing Health Insurance Needs of Elders. And on behalf of myself, SHINE, Elder Source, and the Department of Elder Affairs, we welcome you to today's presentation of Medicare Preventive Services. The SHINE program and its counselors will explain these preventive services and the cost associated with, but not offer medical advice. Online meeting etiquette. Please familiarize yourself with the Zoom menu options. Please hold any questions, and with time permitting, I will be glad to answer them for you at the end of the presentation. Friendly reminder. Please speak clearly and avoid using inappropriate language. Maintain a polite and respectful tone. Thank you. Elder Affairs. SHINE is a program of the Florida Department of Elder Affairs, DOEA. The SHINE program is part of the nationwide State Health Insurance Assistance Programs, SHIP. There are SHIP programs in all 50 states and 4 U.S. territories. The Florida Department of Elder Affairs receives annual funding for the SHINE program from a federal SHIP grant. The Florida Department of Elder Affairs vision is for all Floridians to live well and age well. SHINE's mission is to provide free and unbiased health counseling through a dedicated network of volunteers empowering Florida seniors to make informed healthcare choices. Disclaimer. SHINE is a free program offered by the Florida Department of Elder Affairs in partnership with your local Aging and Disability Resource Center. Specially trained volunteers can assist you with your Medicare, Medicaid, and health insurance questions by providing one-on-one counseling and information. SHINE services are free, unbiased, and confidential. SHINE is not affiliated with and does not endorse any insurance company or product. Area Agency on Aging, AAA. The Department of Elder Affairs administers programs and services for elders through contract agreements with the 11 Areas Agencies on Aging, AAA, in Florida. The AAAs are independent, not-for-profit organizations responsible for ensuring the availability of services to all elders in Florida. The SHINE program contracts annually with the Aging and Disability Resource Centers to provide counseling services locally. SHINE counselors. The primary duty of volunteer SHINE counselors is to help Florida seniors identify, understand, compare, and/or enroll in Original Medicare, Medicare Advantage plans, Medicare prescription drug coverage, Medicare supplement insurance, Medigap, low-income subsidy, extra help for prescription drugs, Medicare savings programs. SHINE counselors also provide counseling for long-term care planning and assist clients with Medicare complaints and appeals. Through the SMP grant, SHINE counselors can provide education on Medicare fraud and abuse, including how to prevent yourself from fraud, how to detect fraud, and how to report fraud. Preventive services topics. Displayed are some preventive services topics. Introduction to preventive services. Living a healthy lifestyle. The best way to stay healthy is to live a healthy lifestyle. You can live a healthy lifestyle by exercising, eating well, keeping a healthy weight, and not smoking. Another important way to stay healthy is to get disease prevention and early detection services. These services can find health problems early and when treatment works best and can help prevent certain diseases or illnesses and or help you avoid their complications. Many people with Medicare don't take full advantage of their Medicare covered preventive benefits. According to the Centers for Disease Control and Prevention, less than 10% of the people with Medicare receive all the recommended screenings and immunizations. Closing this prevention gap could save many thousands of lives and billions of dollars in avoidable medical expenses for preventable medical conditions. Medicare preventive services. Talking with a doctor or other healthcare provider can help determine what preventive services are needed and how often to stay healthy. Medicare coverage of these services may be based on age, gender, and medical history. Beneficiaries must have Part B for Medicare to cover these services. These services are covered no matter what kind of Medicare health plan you have. However, the rules for how much you pay for these services may vary depending on your Medicare Advantage provider. Paying for preventive services in 2025. 2025 preventive services cost under Original Medicare. Under Original Medicare, you will pay nothing for most preventive services if you get the services from a doctor or other provider who accepts assignment. For some preventive services, you will pay nothing for the service, but you may have to pay coinsurance for the office visit when you get these services. If you are in a Medicare Advantage plan or other Medicare plan and get Medicare covered preventive services, you may have to pay copayments. Medicare Dictionary. Assignment means that your doctor, provider, or supplier has signed an agreement with Medicare or is required by law to accept the Medicare approved amount as full payment for the covered services. Covered preventive services. These are the preventive services currently covered by Medicare. Covered preventive services continued. These are the preventive services currently covered by Medicare continued. Preventive visits. The Welcome to Medicare visit is a great way to get up to date on important screenings and shots and to review your medical history. The Welcome to Medicare visit is only offered within the first 12 months of getting Medicare Part B. During the exam, your doctor will review your medical and social history, give you a simple vision test, access your potential risk for depression and your level of safety, and provide education and counseling about preventive services, including height, weight, body mass index, and blood pressure measurements. Certain service screenings, flu and pneumococcal shots, and advanced directives. You will get advice to help you prevent disease, improve your health, and stay well. You also get a brief written plan, like a checklist, letting you know which screenings and other preventive services you need. Your doctor may also refer you for additional Medicare covered screenings if you receive the referral as a result of your initial Welcome to Medicare visit. Be sure to mention when making your appointment that you're scheduling your Welcome to Medicare preventive visit and bring your medical records, including immunization records, family health history, and a list of any prescription drugs, over-the-counter drugs, vitamins, and supplements that you currently take with details. Preventive visits. Medicare covers a yearly wellness visit. After you've had Part B for longer than 12 months, you can get an annual wellness visit to develop or update a prevention plan just for you. Medicare covers one annual wellness visit every 12 months. The Part B deductible does not apply as long as your health care provider accepts assignment. During the visit, your doctor will help you complete the health risk assessment, routine record, record routine measurements, i.e. blood pressure, height, and weight, review your medical and family history, current prescriptions, and potential risk factors for depression. Give you advice to help you prevent disease, improve your health, and stay well. You will get a brief written plan, like a checklist, letting you know which screenings and other preventive services you will need over the next 5 to 10 years. The Welcome to Medicare visit is not a prerequisite for getting an annual wellness visit. However, if you choose to get the Welcome to Medicare visit, you'll have to wait 12 months before you can get your first annual wellness visit. Abdominal aortic aneurysm screening. The abdominal aorta supplies blood to the lower part of the body. When a weak area of the abdominal aorta expands or bulges, it is called an abdominal aortic aneurysm. Aneurysms develop slowly over many years and often have no symptoms. As a result of the Welcome to Medicare exam, the physician may suggest an abdominal aortic aneurysm screening. A referral is required for this one-time screening ultrasound. Someone is considered at risk if they have a family history of abdominal aortic aneurysms, are a man aged 65 to 75 and have smoked at least 100 cigarettes in their lifetime. Medicare covers ultrasound screening for abdominal aortic aneurysms with no deductible or copayment. Alcohol misuse screening and counseling. Adults with Medicare, including those who are pregnant, who use alcohol but do not meet the medical criteria for alcohol dependency, can get the screening. If the beneficiary's primary care doctor determines they are misusing alcohol, they may receive 4 brief face-to-face counseling sessions per year if they are competent and alert during counseling. A qualified primary care doctor or other primary practitioner must provide counseling in a primary care setting like a doctor's office. There are no copayment or deductibles with original Medicare. Bone mass measurement. Medicare covers bone mass measurements to measure bone density. These test results help decide the best plan to keep the bones strong. Osteoporosis is a disease which bones become weak and more likely to break, and someone may not know they have it until they break a bone. Bone mass measurement is covered once every 24 months, or more often if medically necessary. In original Medicare, there is no deductible or copayment. Breast cancer and mammography. Breast cancer is the most common non-skin cancer in women and the second leading cause of cancer death in women in the United States. Every woman is at risk, and this risk increases with age, but it can usually be successfully treated when found early. Medicare covers screening mammograms to check for breast cancer before a doctor may be able to feel it. A mammogram is an X-ray examination of the breast to find any tissue that might be abnormal. Medicare coverage includes digital technology for mammogram screening. A screening mammogram is conducted for a woman with no signs or symptoms of breast disease. Finding small breast cancers early by a screening mammogram greatly improves a woman's chance for successful treatment. This service is covered for all women with Medicare. You may get one screening mammogram from age 35 to 39 and once every year starting at age 40. The first mammogram can be used as a baseline to compare with later x-rays. You don't need a doctor's referral, but the x-ray supplier will need to send your test results to a doctor. You will pay nothing for a screening and baseline mammogram if your doctor accepts assignment. However, for diagnostic mammograms, you will need to pay 20% of the Medicare approved amount after meeting the Part B deductible. Cardiovascular disease screening. Heart disease is the #1 cause of death and a major cause of disability in the U.S. There are many different forms of heart disease. The most common cause of heart disease is narrowing or blockage of the coronary arteries. The blood vessels that supply blood to the heart itself, called coronary artery disease. This happens slowly over time and is a major reason for people to have heart attacks. You can help reduce your risk of heart disease by taking steps to control factors that put you at greater risk, such as control your blood pressure, lower your cholesterol, don't smoke, and get enough exercise. Medicare covers cardiovascular screening tests to check your cholesterol and other blood fat lipid levels. High levels of cholesterol can increase your risk for heart disease and stroke. Tests for cholesterol, lipid, and triglyceride levels are covered once every 5 years for all people with Medicare who have no apparent signs or symptoms of cardiovascular disease. No cost for the test, but you may pay 20% for the doctor's office visit. Cardiac rehabilitation programs. Medicare covers cardiac rehabilitation for patients with certain conditions. It is a comprehensive program that includes exercise, education, and counseling. Medicare also covers intensive cardiac rehabilitation programs that are typically more rigorous and more intense than regular cardiac rehabilitation programs. You pay 20% of the Medicare approved amount if the services are rendered in a doctor's office. In a hospital outpatient setting, a copayment may apply. The Part B deductible applies. Cervical and vaginal cancer screening. Medicare covers Pap tests, pelvic exams, and clinical breast examinations for all women with Medicare. Pap tests help find cervical and vaginal cancer, and screening pelvic exams help find fibroids, ovarian cancers. These services are covered once every 24 months for most women. However, they may be covered every 12 months if you are at a high risk for cervical or vaginal cancer based on your medical history or other findings. You are of childbearing age and have had an abnormal Pap test in the past 36 months. Clinical breast examinations are another way to screen for breast cancer and may be performed during this exam. You pay nothing for the Pap lab test, lab HPV with the Pap test specimen collection, and pelvic and breast exams if the doctor accepts assignment. Colorectal cancer screening. In the United States, colorectal cancer is the fourth most common cancer in men and women. Caught early, it is often curable. To help find precancerous growth and help prevent or find cancer early when treatment is most effective, a doctor may order one or more of the following tests if certain conditions are met. Fecal occult blood test, flexible sigmoidography, colonoscopy, barium enema. Medicare defines high risk of developing colorectal cancer as someone who has one or more of the following risk factors. Close relative, sibling, parent, or child who has had colorectal cancer or polyps. Family history of familial polyps. Personal history of colorectal cancer. Personal history of inflammatory bowel disease, including Crohn's disease and ulcerative colitis. Note, for Medicare beneficiaries at high risk of developing colorectal cancer, the frequency of covered screenings may be different from beneficiaries not considered at high risk. Colorectal cancer screening. There is no copayment for the tests themselves. If a biopsy or growth is removed during a colonoscopy, you will pay 20% coinsurance. Coronavirus disease 2019, COVID-19. Medicare Part B medical insurance covers a test to see if you have coronavirus, officially called coronavirus disease 2019 or COVID-19. Medicare covers and you pay nothing for tests to diagnose or aid the diagnosis of COVID-19. Some tests for related respiratory conditions and diagnosis of COVID-19 done together with the COVID-19 test. Depression screening. Screening for depression is covered one time in a 12-month period. It must include, at a minimum level, staff-assisted depression care support consisting of clinical staff, e.g., nurse, physician assistants, in the primary care office who can advise the physician of screening results and who can facilitate and coordinate referrals to mental health treatment. Coverage is limited to screening services and does not include treatment options for depression or any diseases, complications, or chronic conditions resulting from depression, nor does it address therapeutic interventions such as pharmacotherapy, combination therapy, counseling or medications, or other interventions for depression. Diabetes screenings. Medicare covers diabetes screenings for all people with Medicare with certain risk factors for diabetes or diagnosed with prediabetes. Some of those factors include high blood pressure, high cholesterol, obesity, and high blood sugar levels. The diabetes screening test includes a fasting blood glucose test. Talk with your doctor about how often you should get tested. For people with prediabetes, Medicare covers a maximum of 2 diabetes screening tests within a 12-month period, but not less than 6 months apart. For people without diabetes, diagnosed as prediabetics, Medicare covers 1 diabetes screening test within a 12-month period. Medicare provides coverage for diabetes screening as a Medicare Part B benefit after a referral from a physician or qualified non-physician practitioner for an individual at risk for diabetes. You pay nothing for this screening. There is no coinsurance or copayment and no deductible for this benefit. Medicare Diabetes Prevention Program. Services can be provided virtually through December 31st, 2027, or in person from an approved supplier. You can find a supplier on Medicare.gov. With Medicare Advantage, you may need to go to an in-network provider for these services. Diabetes self-management training. Medicare provides coverage of diabetes self-management training for beneficiaries who have diabetes. Medicare Part B covers up to 10 hours of diabetes outpatient self-management training during 1 calendar year. It includes education about how to monitor your blood sugar, diet, exercise, and medication. You must get an order from your doctor or qualified provider who is treating your diabetes. Each session lasts for at least 30 minutes and is provided in groups of 2 to 20 people. Exception. You can get individual sessions if no group session is available or if your doctor or qualified provider says you have special needs that would prevent you from participating effectively in group training. You may also qualify for up to 2 hours of follow-up training each year if your doctor or qualified provider ordered it as part of your plan of care. It takes place in a calendar year after the year you got your initial training. The training teaches managing and coping with diabetes, healthy habits like eating and activity, how to monitor blood sugar, taking prescription drugs, reducing risk. The Medicare Part B deductible and coinsurance or copayment apply. Some providers must accept assignment. Covered diabetes supplies. Medicare covers insulin pumps, special foot care, and therapeutic shoes for people with diabetes who need them. Insulin associated with an insulin pump is covered by Medicare Part B. Insulin that is injected directly is covered under Medicare Part D drug plans. In original Medicare, you pay 20% of the Medicare approved amount after the annual Part B deductible for a glucometer, lancets, and test strips. Note, You may save money if you mail order your diabetes supplies. Check with your plan. Medicare provides coverage for diabetes related to durable medical equipment, DME, and supplies as a Medicare Part B benefit. The Medicare Part B deductible and coinsurance or copayment applies. If the provider or supplier does not accept assignment, the amount you pay may be higher. In this case, Medicare may refund the Medicare approved amount to you. For more information, please review Medicare coverage of diabetes supplies and services, CMS publication number 11022. Glaucoma screening. Glaucoma is an eye disease caused by above normal pressure in the eye. It usually damages the optic nerve and you may gradually lose sight without symptoms. It can result in blindness, especially without treatment. The best way for people at high risk for glaucoma to protect themselves is to have regular eye exams. You are considered high risk for glaucoma and eligible for Medicare coverage of the glaucoma examination if you have diabetes, have a family history of glaucoma, are African American and age 50 or older, or are Hispanic and age 65 or older. You pay 20% of the Medicare approved amount and the Part B deductible applies for the doctor's visit. In a hospital outpatient setting, you pay a copayment. Hepatitis B virus, HBV infection screening. Medicare covers HBV infection screenings if you are at high risk or pregnant. Your primary care doctor must order the infection screening. Medicare covers these tests. Once a year, if you're at continued high risk and don't get a hepatitis B shot. If you're pregnant, at the first prenatal visit of each pregnancy, at the time of delivery for those with new or continued risk, at the first prenatal visit for future pregnancies, even if you previously got the hepatitis B shot or had negative HBV screening results. You pay nothing for the screening test if your doctor or other qualified healthcare provider accepts assignment. Medicare Part B will also cover preventive hepatitis B shots if someone had medium or high risk and they have certain conditions. Hepatitis C screening test. Medicare covers a screening test if your primary care doctor or other primary care provider orders it and you meet one or more of these conditions. You're at high risk because you use or have used illicit injection drugs. You had a blood transfusion before 1992. You were born between 1945 and 1965. If you're at high risk, Medicare covers yearly screenings. If you were born between 1945 and 1965 and aren't considered high risk, Medicare pays for the screening once. Medicare will only cover hepatitis C screenings test if your primary care doctor or other primary care provider orders them. You pay nothing for the screening test if your doctor or other qualified healthcare provider accepts assignment. Human immunodeficiency virus, HIV screening. HIV is a virus that causes AIDS. HIV attacks the immune system by destroying a type of white blood cell that is vital to fighting off infection. The destruction of these cells leaves people infected with HIV vulnerable to infections, diseases, and other complications. Medicare covers HIV screening for people with Medicare who are pregnant and people at increased risk for the infection. Medicare covers this test once every 12 months and up to 3 times during a pregnancy. There is no cost for the test, but you generally have to pay the 20% of the Medicare approved amount for the doctor's visit. Lung cancer screening. Medicare Part B medical insurance covers lung cancer screenings with low dose computed tomography, LDCT, once each year if you meet all of these conditions. You're age 50 to 77. You don't have signs or symptoms of lung cancer, asymptomatic. You're either a current smoker or have quit smoking within the last 15 years. You have a tobacco smoking history with at least 20 pack years, an average of 1 pack, 20 cigarettes per day for 20 years. You get a written order from your doctor. Before your first lung cancer screening, you'll need to schedule a lung cancer screening counseling and shared decision-making visit with your doctor to discuss the benefits and risk of lung cancer screening. You and your doctor can decide whether lung cancer screening is right for you. Medical nutrition therapy. Medical Medicare covers medical nutrition therapy if you have diabetes, kidney disease, or if you had a kidney transplant in the last 36 months. Your doctor or healthcare provider must refer you for the service. A registered dietitian or nutrition professional will provide services that include a nutritional assessment, one-on-one counseling, and therapy services. Services cover up to 3 hours of one-on-one counseling during the first year. For each year after that, you may receive 2 hours of counseling. You pay nothing for these services if the doctor accepts assignment. Obesity screening and counseling. Medicare covers obesity screening and counseling when provided in a primary care setting, and the beneficiary has a body mass index, BMI, of 30 or more. Benefits include one face-to-face visit every week for the first month, one face-to-face visit every other week for months 2 through 6, one face-to-face visit every month for months 7 through 12. If the beneficiary meets the 6.6-pound weight loss requirement in the first 6 months of the intensive therapy. Intensive behavioral therapy for obesity consists of the following: screening for obesity in adults using BMI, dietary nutritional assessment, intensive behavior counseling, and behavior therapy. Prostate cancer. The older you are, the greater risk of getting and being diagnosed with prostate cancer. While all men are at risk for prostate cancer, your risk increases if you have a father, brother, or son who has had prostate cancer. The list on this slide shows the groups at risk for prostate cancer from higher to lower level of risk. Prostate cancer screening. Medicare covers screening for prostate cancer every 12 months for men age 50 and older. Coverage begins the day after your 50th birthday. The tests in this screening include the prostate specific antigen PSA blood test and a digital rectal examination. There is no cost for the PSA blood lab test. You pay 20% of the Medicare approved amount for the digital rectal examination after the yearly Part B deductible in original Medicare. A co-payment may apply in a hospital outpatient setting. Sexually transmitted infections, STI, screening and counseling. Medicare covers screening and counseling services for sexually transmitted infections such as chlamydia, gonorrhea, syphilis, and/or hepatitis B. Screenings are available once every 12 months to all people with Medicare, including individuals who may be pregnant and certain people who are at an increased risk for an STI. Behavioral counseling sessions are available for sexually active adults who are at an increased risk for STIs. Each year, Medicare covers 2 individual, face-to-face, high-intensity counseling sessions lasting for 20 to 30 minutes. There are no costs for the screening or counseling if the doctor or primary care practitioner accepts assignment, and it takes place in the physician's office or a primary care clinic. Flu shot. Generally covered once per flu season in the fall or winter. You pay nothing for the flu shot if the doctor or other healthcare provider accepts assignment for giving the shot. Note, Medicare Advantage plan vaccine costs will vary depending on the type of shot and if you have an in-network or out-of-network provider administer the injection. Hepatitis B shots. Hepatitis B is a serious disease that attacks the liver and can cause cirrhosis, cancer, or death. Covered for people at medium or high risk for hepatitis B. Your risk for hepatitis B increases if you have hemophilia, end-stage renal disease, ESRD, or certain conditions that increase your risk for infection. Other factors may increase your risk for hepatitis B, such as living with another family member with hepatitis B, or if you are a healthcare worker, so check with your doctor. You pay nothing for the shot if your doctor accepts assignment. Pneumological shot. Medicare covers a pneumological vaccination to protect against different strains of the bacteria that causes pneumonia. Pneumonia is an inflammation in the lungs caused by infection with bacteria called Streptococcus pneumonia. It can infect the upper respiratory tract and can spread to the blood, lungs, middle ear, or nervous system. Most people only need a pneumological pneumonia shot once in their lifetime. Medicare will cover additional shots if your doctor decides it is necessary. All people with Medicare are eligible for this benefit. You pay no coinsurance and no Part B deductible in original Medicare if your healthcare provider accepts assignment. Smoking cessation. Medicare covers services to help people quit smoking and other tobacco use. The U.S. Surgeon General has reported that quitting smoking leads to significant health benefits, even in older adults who have smoked for years. Anyone who uses tobacco may receive counseling from a qualified doctor or other Medicare recognized practitioner who can help them stop using tobacco. The benefit covers people with Medicare who have an illness caused or complicated by smoking. This includes smokers with heart disease, lung disease, stroke, multiple cancers, weak bones, blood clots, or cataracts. Coverage also applies to people taking medications affected by smoking, such as insulin and medicines for high blood pressure, blood clots, and depression. Smoking cessation services. Medicare Part B covers cessation counseling for individuals who use tobacco and have been diagnosed with a recognized tobacco-related disease or who exhibit symptoms consistent with tobacco-related disease. Medicare will cover 2 cessation attempts per year. Each attempt may include up to 4 counseling sessions, with a total annual benefit covering up to 8 sessions in a 12-month period. Services can be provided in the hospital or on an outpatient basis. However, the benefit does not cover hospitalization if tobacco cessation is the primary reason for the hospital stay. You must get counseling from a qualified Medicare provider, physician, physician assistant, nurse practitioner, clinical nurse specialist, or clinical psychologist. If there is no sign of an illness caused or complicated by tobacco use, you pay nothing for the counseling session. If you use tobacco and have been diagnosed with an illness caused or complicated by tobacco use, or you take a medicine that's affected by tobacco, you pay 20% and the Part B deductible. In a hospital outpatient setting, you also pay the hospital copayment. Many drugs are available to help you quit smoking, like nicotine patches, and these drugs may be covered by your Medicare Part D prescription drug plan. Key takeaways. Today, we have talked about steps you can take that may help you live longer and a healthier life. These steps include taking advantage of the many preventive services covered by Medicare. These services are available whether you are covered by Original Medicare or Medicare Advantage or other Medicare plan. To find out the costs for screenings and counseling under a Medicare Advantage plan or other Medicare plan, you may contact your plan or review the summary of benefits sent to you in your membership packet. There are many resources of information if you want to learn more about Medicare preventive services. Check the internet at medicare.gov, review publications, or call 1-800-MEDICARE. Preventive services information. If you want to know more, visit the Medicare website at medicare.gov, select Providers and Services at the top of the screen, then select what Medicare covers from the drop-down menu. If you want to know more, continued. Beneficiaries can search preventive and screening services on medicare.gov to determine what Medicare covers. If you want to know more, continued. Or you can register for your own personalized and secure web page on mymedicare.gov. This web page gives you access to information on your benefits and services, including your preventive services. You can receive email reminders when you are due for Medicare covered preventive services. If you want to know more, continued. There are numerous sources of information on preventive services. The Centers for Medicare and Medicaid Services, CMS, publishes a flyer called Your Guide to Medicare Preventive Services, publication number 10110. This brochure is available in English, Spanish, and Chinese, as well as in TTY format. Information on public services is also covered in the Medicare and You Handbook and in your Medicare Benefits publication 10166. These publications are available in both English and Spanish. The Medicare helpline is always a source for more information at 1-800-MEDICARE. TTY users should call 1-877-466-2048. If you want to know more, continued. Your local state health insurance assistance program, SHIP, provides information on preventive services. The contact number is in the Medicare and You Handbook on pages 115 through 118. Remember, in Florida, SHINE is the SHIP program. One of our trained counselors can help to answer your questions. Many of the preventive services are screening for early detection of cancer. You can get additional information from the American Cancer Society website at cancer.org or the toll-free number at 1-800-227-2345. If you want to know more, continued. The National Cancer Institute's Cancer Information Service, CIS, provides personalized, confidential answers to specific questions about cancer and also provides assistance to smokers who want to quit. Help is available in English or Spanish by telephone at 800-332-8615 and online in English through the live help link at cancer.gov on the web. Other information sources include the Centers for Disease Control and Prevention at cdc.gov and the Surgeon General's website, which provides reports and publications related to tobacco use. Medicare contact information. Medicare contact information. Displayed is the Medicare contact information for Florida SHINE and CMS. SHINE. SHINE counselors offer free and unbiased assistance to help seniors identify, understand, compare, and/or enroll in original Medicare, Medicare Advantage plans, Medicare prescription drug coverage, Medicare supplement insurance policies, Medigap, Medicare prescription drug low-income subsidy, Extra Help, Medicare savings programs, Medicare long-term care planning, insurance, and financing, other public and private health insurance. Questions or comments? Please hold any questions or comments until the end of the presentation, and with time permitting, I'll be glad to answer them for you. Contact the local SHINE program. Elder Source. The local PSA for SHINE Contact in Jacksonville, Florida is Elder Source, located at 10688 Old St. Augustine Road, Jacksonville, Florida 32257. The phone number is 888-242-4464. Tell us how we are doing. Please complete a short survey at the URL listed here, tinyurl.com/survey4shine, and tell us how we are doing. End of presentation. Lastly, on behalf of myself, Shine, Elder Source, and the Department of Elder Affairs, we appreciate your time and participation in today's presentation. We hope that this presentation has provided an insight into becoming educated and to better assist you with your Medicare endeavors.